In a world where technology is revolutionizing every sector, can healthcare stay behind? Traditional patient history taking can be time-consuming and inefficient. But what if AI could streamline this process? Introducing the AI chatbot, a virtual nurse avatar. This AI technology can take patient history efficiently before the patient arrives at the clinic. The doctor can then review this history, saving valuable time. This technology not only streamlines the process but also improves patient experience. The AI chatbot is revolutionizing healthcare, one patient at a time. The future of healthcare is here, and it's powered by AI. Join the revolution and embrace the power of AI in healthcare. Because at the end of the day, it's all about providing the best care for our patients. And with AI, we can do just that. So, are you ready to step into the future of healthcare? Because the future is here, and it's more efficient, more caring, and more patient-centric than ever before. Welcome to the revolution in healthcare, powered by AI.
Hello and welcome to our weekly webinar series on the transformative role of AI for the NHS. My name is Kiran Fulton and I will be one of your presenters today. Now, AI now is becoming a pretty common name. We are talking about it and it is really important to understand AI. This is our third webinar and today we are going to focus on the transformative innovation of NHS using the power of artificial intelligence. Now, before we start, I want to do a quick thank you to the Conservative Friends of the NHS for making this webinar possible, along with our guest speakers. So let me introduce him. Dr. Suhail Chughtai is a London-based orthopedic surgeon with wide clinical experience in and out of the NHS. He's also a strategist in the field of AI and telehealth. He has designed over 12 major telehealth software and some of which have been acquired by international healthcare providers. Dr. Chughtai holds a certification from MIT USA in the Artificial Intelligence Empowered Healthcare and a fellowship in clinical telemedicine. Besides being a Microsoft certified specialist, he is currently serving as a chief technology officer for a Dubai-based healthcare company called the Health Bank Global, and also as director of health, Conservative Friends of NHS. We'll hand it over to you, Dr. Chughtai, as you will be giving us a full-on demonstration on transformative innovation of NHS using the power of artificial intelligence. Over to you.
Thank you very much, Kiran. That's a very illustrious introduction. I appreciate that. So I think it's a journey. It's a very interesting journey, and it is still going on. And every day I find myself at the beginning. That is the generative AI. After having done 30 years of active computing, 20 years of healthcare computing, when I wake up with generative AI in the morning, it feels like it's starting again. That is the depth of this. It's like a watershed line. It is just like the broadband came into the market. That is what the effect generative AI is creating in the digital market. So allow me to take you forward, and I'm going to introduce Virtual Jennifer. Virtual Jennifer is a persona I created and trained for orthopedic practice. I thought this may be a good example to start with. If an orthopedic surgeon practice can be maintained and managed through virtuality, in the like giving appointments, then it can go to any practice. But I want to share and take your views. And remember, it's only the beginning of this generative AI era. So, as a patient would use an app to connect to a clinic, or they can connect to a doctor. In this example, it's my clinic being shown, so that if the patient connects here, then it'll go to another screen. But before that, the patient would have signed or seen a disclaimer that the medical advice given by the system is through an artificial intelligence system, which is learning. And if you have any doubt, there is a number below in the disclaimer. They can always call and ask. But remember one thing, that acute conditions are not being managed here. Life-threatening conditions are not being managed here. When the patient calls in, the system has capacity and it's being trained that if there is a pain of intensity, the system will immediately say, look, it's beyond me, please call the doctor or call 999, and that disclaimer part will come before patient reaches this. So once the patient reaches that screen, they will select a doctor, and then this will start. And I'm just going to show you a 3-4 minutes demo, a screen video recording of how my practice will engage with a patient. Now that is an example that if I can train computer to do this, any computer can be trained for any practice. And so this is the beginning, and I just want to show you virtual Jennifer, because she was the first secretary of when I took a consultant post back in '95 as a locum consultant. My secretary was Jennifer, so it's a tribute to Jennifer who was taking such an inexperienced young consultant, and she kind of borne all the silly things I've done at that time, being a very young consultant. So I'm starting now to share this demo. Please take a look. Good morning. So, by the way, this good morning is not from me. I'm acting as a patient called Shakil Khan, who is about 40 years of age, and he has called to take advice for knee pain and want to make an appointment with a GP. I want some help regarding my right knee pain. So I have trained this to ask the name first so that we can control the documentation, because all this documentation is going to my clinic. So if the patient forgets to tell the name, the system is now trained to ask the name. And that is an important point, that we can train the system. My name is Shakil Khan. Again, this is for knee pain. This is the musculoskeletal system. So the computer has already been trained, the generative AI, but I added few information that after the name and then start asking about the detail of the particular region. It has been trained to ask the age as well, which this time it skipped. So I'm training it further to ask the gender and the age before asking the details of the symptom. I have been facing a problem with my right knee for the last 2 weeks, and the pain is mainly at the front of the knee. So you may notice that it is summarizing at the same time, keeping link to what has been registered. At the same time, it is doing inert advice, like simple methods to solve or help the pain. But that's not all. As I apply ice on it, it feels better. I'm also taking some paracetamol, which makes it temporarily better, but it comes back as soon as I start climbing stairs or start walking for 10 minutes. So that is where it is a safe approach, that once the documentation, the information has been taken, the patient's intent is to take an appointment with the GP. If it's not, it will be evident on the next screen. If it is, the patients follow the track. So at this point, the patient is being asked to have an evaluation of the symptom by physical examination. For that, an appointment is suggested. Can you possibly tell what could be wrong with my knee? I am about 45 years old. I want to explain one point here. 10 years ago, when I made a chatbot, I used Python language. That was based on what if and the keywords. Now, in this system, you notice that the patient is now giving his or her own ideas. It's not using keywords. It is giving thoughts, and natural language processing based system will follow the unstructured documentation and the background. So whatever the patient has said now, it's not on the screen. It's a totally different direction. If it's a standard chatbot, that will stop here. But because it's a generative AI chatbot or artificial intelligence of different kind, this will continue because it will look back on the unstructured system. So you can see that patient has been given some information about knee pain of 2 weeks duration without any trauma, acute trauma or injury. But at the same time, the direction is towards the appointment, not taking responsibility of actually treating this patient by the AI.
I do not have any other medical issues, although I go to gym quite regularly, and I remember increasing my routine at the gym last month. Could that be a reason?
So the AI or virtual Jennifer has registered the new information, and that she's going to pass on to the consultant or the doctor in the clinic. But it's important to stay anchored to where we are. A standard chatbot made on Python or what if technology is going to stop here or fail or take in a different direction. And that is the benefit of this new artificial intelligence.
Okay, fine. Can you suggest me the schedule of appointments?
So this is what I provided when I was training this model. I was creating a persona, and I provided as much details as possible. Again, training of this system is very important. You need to train in such a way that what is on the screen, create 10 MCQs of that. That is the possible, whatever information I'm giving on the screen, there could be 10 questions raised from that. Answer to those 10 questions would be in the system. And also, what is not on the screen, that direction we should keep ready. So the training part is very critical, very important. And at the same time, then linking this to the website or the email is a second part.
I can come on Wednesday at 2:30 p.m.
So in this system, I've trained the virtual Jennifer chatbot to ask for email address. If the patient had said, I'm not comfortable giving you my mobile number, then the next question was, fine, I accept that. Can you please provide me your email address? So that would have been my next option if the patient has refused to give the mobile number.
Okay, my number is 0739 549 2121. What is the cost of consultation?
So that came from this payment, because I mentioned payment here. So what could be the possible question a patient will be asking at this point? So that direction is always in the backup.
Okay, that's fine. But is there any parking space?
See that parking, there's no word mention of parking here, but there's word of appointment. So from that, you need to deduce what is patient thinking? You need to go out of this screen and think, what can patient ask next? So I provided this information that we have 10 spaces, and then they are a first come, first serve basis. And then there's off-street parking as well. So that information was in the backdrop.
So what is the nearest tube station if I can't bring my car?
So again, you have to think that when you're training chatbot, that patient cannot always bring their car. What is the next option? So as I said, that while training, that is the critical part, that you need to really go very creative, imaginative, and beyond the screen. And then also, when you say Knightsbridge, then you may need to tell from Knightsbridge how to reach your clinic.
Thank you. Also, please tell me if I can bring my brother and his wife with me, as they would be accompanying me on that day.
Can you notice that I said accompanying me? It put committing. Maybe my accent is not picked up. But look at the intelligent chatbot. That's the important aspect. It understood it's not committing. I didn't mean committing. Just take a look.
That is fine. Thank you. And just last point, if I want to reschedule this appointment, can you provide me a number and name of the person whom I can call?
Again, this is a backup that if you go by a Python chatbot, this will not be expected.
Great. Thank you. I appreciate that. Bye for now. Good morning.
So that's how it ends. And I just want to reiterate that what we've gained from this. I strongly believe that there are benefits of artificial intelligence nurse and clinic manager. First of all, there is 24/7 availability. People are traveling. They can make appointments even they're abroad, they're at airport. They don't need to wait for the 9 o'clock in the morning or 8:30 in the morning for the narrow window to make an appointment. And just look at the figures. There was a survey done in 2022 at, I think it was June to August. And 75% patients faced difficulty in booking face-to-face appointment in the last 12 months. They could book online appointment, video appointment, but only 16% patient wanted that. 26% were unable to contact the GP practice at the times suitable to them. That is the key point. 43% reported making appointment on the phone a time-consuming process. So, structured pre-consultation documentation, I would be presented this set of notes before the patient comes to my clinic. Great value to me. Cost-effective and time-saving. All these notes will go into the patient system or come as an attached PDF file. It's simple, it's cost-effective because this will just cost in the beginning, but after that, there's no person sitting to manage that. There is efficient use of GP surgery staff. The person who was doing this duty before can now manage something else. That person can stay on the reception to manage the patients coming in person. She doesn't have to be on the phone while she's managing patients coming in person. And the engagement is very enhanced. You may say that it's a virtual system. Why the engagement is enhanced? Because with learning and training, the actual system will recognize and will become very close, kind of associated with that, and will be very sympathetic. Will never forget the courtesy. Will always make sure that even if there is a tough kind of rushing appointments, people are going one after other, the computer will not forget to be courteous. There's no time pressure. Like patient can stay as long as they want, and there is no time loss of GP surgery. The basic health guidelines are given for the non-urgent conditions, which means that those ones can be managed while the patient is waiting for appointment. It's not that the patient has to come to GP to find out what to do. It's multilinguistic. We can change it to many languages. In this example, I kept the other side silent, but actually you can always make it speak. Patients who cannot reach the clinic or are hard of hearing, they can make an appointment through the system if they are literate enough on computer, or somebody else can do it for them. And it is minimized for human errors because the appointment given will be always from the schedule on the system. It cannot make an error. So, I mean, given all the facilities, all the benefits of that, I have been convinced. I was partially convinced when it was Python type of chatbots because they could lead to error. With generative AI, I don't see a problem. And mind you, we are only starting